Welcome to this episode of Monday Morning Joe. I'm Dr. Chuck Vega from the University of California at Irvine. Monday Morning Joe is a quick-hitting coffee talk style 4-episode series on the latest and greatest regarding multi-cancer early detection tests. The goal of this segment is to provide you with a better understanding of the science behind multi-cancer early detection tests, or MCEDs, specifically those that measure cell-free DNA released by cancer cells. Before we begin, please remember to subscribe to the Exchange CME YouTube channel and turn on your notifications so that you won't miss a new episode in this series. Okay, let's get started. We think about a traditional biopsy. When I hear biopsy, I think of a tissue biopsy. This is usually going to be invasive. It can be painful. It can be quite difficult when the tumor is near sensitive organs and in frail patients. But what about a liquid biopsy? I will say that personally speaking, when I heard liquid biopsy, I did not know what that meant. This is several years ago. But this is a non-invasive test. And here you can use tests that we use all the time, like a blood test in this case. We're going to talk about blood tests. But it could also even apply to, say, a urine test. And the benefit, obviously, of a liquid biopsy is it's much easier to obtain, it's readily available, and while we're going to talk today about using it for screening for cancer, it can eventually be used to actually follow treatment and see how treatment of active cancer is going. How do we use simple blood tests, liquid biopsies, to detect cancer? Well, cell-free DNA is at the core of that process. So cancer is, by its very nature, unstable. There's a lot of cell turnover. There's a lot of cell death. It's not organized because it's cancer. And so there's a constant showering of cell-free DNA in the bloodstream. And that comes via apoptosis, via necrosis, via secretion. And cell-free DNA can be really valuable in terms of cancer detection. There are a number of different anomalies, whether it's apoptotic bodies or exosomal DNA, methylation patterns we're going to spend some time on, or point mutations that are detectable and when found in a certain number can indicate there's a cancer signal in an individual patient. So what is DNA methylation? I like to think of methylation as the traffic cop of DNA transcription. So it is essentially suppressing some areas of DNA, telling other areas to be transcribed into proteins. And I think the important thing for our understanding today is that DNA methylation has certain patterns. So the DNA methylation pattern you might see in a hepatocyte, a liver cell, is different from what you might see in a neuron or a muscle cell. So each organ has their own pattern of methylation, and in addition, each cancer has certain patterns of methylation. And using machine learning, these definitions can be really quite more precise and allow us to pinpoint not only that there could be a cancer in a patient, but actually predict the site of origin of cancer, the anatomic side of that cancer as well. And one question that comes up pretty frequently is, well, this sounds a lot like genetic testing. Is that what we're talking about here? Actually not. Genetic testing is really more of a risk calculation, and then you take action after that risk calculation. Maybe you do further genetic testing for, say, a BRCA mutation, or you recommend a certain screening procedure like an MRI or even a PET scan based on that genetic counseling. But MCEDs are actually a screening modality in themselves, which will be one of the things that a genetic counselor could recommend. This is not something that's way out there coming in the future. This is not Star Trek. This is something you can actually order today. So there are 3 cell-free DNA based MCED assays that are currently approved by the FDA for breakthrough device designation, and there's one test, Gallery, which is commercially available right now, so you can order it right now for your patients. Gallery can detect over 50 different types of cancer, so you can see the potential advantage right away in that you can detect certainly the cancers that we're used to screening for, such as breast and colorectal, but a lot of cancers that we heretofore had no good screening tool for. The Gallery test really really offers a way and a window into a better method of cancer detection, early treatment, and better outcomes. So let's close with some take-home points. And to me, it's the fact that blood-based MCEDs offer some real distinct advantages over our traditional tools for screening for cancer. And that they really depend on this methylation pattern is one of the strongest ways we can detect cancer. And it tells you, the methylation patterns tells you about the specific cell where the DNA came from, and also whether it's cancerous or not. And so it's a way to link not just whether there's a cancer signal detected, but actually where that cancer came from in the body, the anatomic site of origin. And finally, we have great news in that there is a commercially available MCED available in the United States called Gallery that can detect over 50 different types of cancer with a single blood test. Pretty remarkable stuff, and we will be delving into more issues and some of the data around MCEDs as we move through this Monday Morning Joe series. Thank you very much for joining me today. Hopefully you're as excited about learning more about MCEDs as I am. As we discussed earlier, you can check back for new episodes in this Exchange CME YouTube page. Clinicians, nurses, and pharmacists can also visit exchangecme.com for free access to CME in a variety of different therapeutic areas. Thanks again, and we'll see you on the next episode of Monday Morning Joe, where I'll review the data from clinical trials of MCED tests.